COVID-19 pandemic has exposed just how expensive healthcare is in South Africa. While the country's health infrastructure has been further weakened, RH Bophelo has entered a strategic partnership with the World Bank's International Finance Corporation to support its expansion plan, which is attracting an estimated $56 million worth of investments. This is for the purposes of building more healthcare facilities in South Africa as well as other countries. Joining us to talk about how this investment will boost healthcare affordability is RH Bophelo CEO Quinton Zunga. Quinton, a very good morning to you. Thank you so much for joining us this morning and for your time. What we know is that COVID-19 has reshaped the healthcare system, healthcare investment landscape in not only South Africa but in the world. This sounds like a groundbreaking deal that RH Bophelo is in. Just tell me, how will that help, especially with South African healthcare?
Indeed, thank you, and good morning to your viewers. This transaction and partnership will result in more capital being invested in affordable healthcare facilities, and these are necessary in the respect that they are located in the peri-urban and rural settings where there are high population nodes. And as you know, there's still quite a lot of people that have to travel many, many kilometers to get to a health facility. There's still quite a lot of people that do not have the right quality of healthcare facility. And we are trying to change that and make sure that healthcare is accessible to all in this country and within the continent. And this transaction is part of it.
Now, as a player in the healthcare system in South Africa, healthcare sectors, I mean, you've got 18 hospitals and 14 additional that you manage as well, so you'd be well versed with the sector. What did COVID-19 highlight most for RH Bophelo? What did you find once this pandemic hit?
I think the key thing was understanding how to work within the COVID protocols. We learned quite a lot of things around managing staff. We learned quite a lot of things about managing resources, especially at the peaks. The peaks being the third wave were quite brutal in terms of their demands, and we were able to understand how to manage it. We did not close any of our facilities from the onset, and we've been able to trade within the pandemic, managing the peaks as they come. So this augurs well for any eventualities going forward, in that we are prepared, we are ready, we know how much resources we need, especially relating to oxygen, and we can provide a service.
I mean, if you look at what healthcare looks like at the moment, we've had what seems like austerity measures. I know government has gone and said that that's not what's happened, but we've had essentially a cut in budget over the last number of years, which has crippled our healthcare sector in South Africa. It's a very important space that you play in at the moment, but aren't you a little bit worried about our overburdened healthcare sector as it stands at the moment, especially with what COVID-19 did over the last 3 waves or so?
Look, I think currently the anecdotal data is the current wave has not resulted in huge pressure, but of course we are worried that there is a big mismatch between the overburdened public sector and the private sector, and this is one of the things that our company is trying to address. That going forward, the capital that's invested in this sector needs to be allocated more efficiently to allow proper access to a lot more people. So currently you do have the challenge that the public sector is overburdened, and when there is a high incident of utilization, you do have massive challenges. That said, I think there has been a reasonable cooperation between the private and the public sector within the COVID peaks, in order to actually alleviate the pressure that was coming from the onset from COVID-19. So we think that platform will get better, and a lot more working together will be done.
And I mean, with this deal with the IFC at the moment, it seems like you'll be able to play that middleman or be in that middle ground a little bit more. Can you just talk to us about how that would look, bringing affordable quality healthcare to those who are low-income earners, especially those who can't access private hospitals, and how accessible would it be? Obviously, we do have low-income earners, but we also have people who just simply can't afford in South Africa. So how would they be affected by this?
So basically, IFC is an international finance organization with one of its mandate is healthcare and accessibility, and this capital that they are providing for us allows us to build and manage in the peri-urban and rural areas. So this capital will be uniquely positioned to provide new facilities in the growing nodes around the country, thereby increasing access. I think here is a perfect example of us partnering within the context of healthcare with other organizations with a common purpose. I think the common purpose here is we really do think that a lot more can be done to provide access, especially for those who can't afford within the current parameters. So we are expanding that parameters, and we are delighted that the IFC has partnered with us on this joint vision, which we think will go a long way in changing the landscape.
So would there still be a cost involved when it comes to using the facilities of RH Bophelo?
There will be a cost involved, but we're glad to say that we want that cost to continue to go lower. I think ultimately the way we see it, there are many avenues now. Right now, RH Bophelo owns a healthcare insurance called Westmart, where you can get medical cover for less than 300 a month and be able to access our facilities. So there is now the access component to our facilities, which the public and the low-income earners are able to utilize. So yes, there will be costs, but the cost should be affordable, and that's what RH Bophelo is trying to do.
Let's look at this pandemic, excuse me, a little bit closer, Quinton. It was something that, of course, put the country to a standstill, but looking at the response of South Africa's government, comparing it, of course, to the West, what would you make of it?
I think the response has been good in parts and slow in some parts. I think we definitely were a bit slow on the vaccination. Even now, the vaccination numbers are not that, great. So vaccination was a challenge. But I would like to say meeting the demands in the peaks in terms of providing healthcare facilities was reasonable. I think we saw a very rapid reorientation of facilities to provide the beds needed. We didn't completely run out of beds in the public sector. So the government has to be commended. But we were looking at holistically. I think the government has reasonably performed, but there were some areas which could have been improved.
I mean, will you guys be working quite closely with the government? Throughout the year, we've heard so many reports of qualified intern doctors sitting at home without jobs, which is really a travesty with our overburdened healthcare system.
Absolutely. We want to work with the government more efficiently. I think the challenge is, of course, the bureaucracies and that one may encounter. We think that with a growing company like RH Bophelo, which is invested in healthcare, healthcare, financial services, in infrastructure. We need that human manpower. We need the doctors, but we've got to get to a point where the government and the public sector and private work together efficiently in order to get an ultimate goal. So it is a challenge that doctors are not working when the facilities need these doctors. I think, generally speaking, we have a shortage of doctors. So one would hope that a better coordinating platform is availed to within the private and public sector for such situations not to occur anymore. So we are open for the government, we're open for the government's vision, and we share the same vision of access for healthcare to all, and that's what we're trying to do.
And that's the gap that you are trying to bridge with, I suppose, the company and this investment that you have here. But just to quickly speak about that gap, it does seem like the gap between private and public healthcare is really wide. What happens if somebody needs more specialized healthcare, something that you can't really find in perhaps a public hospital?
So the public hospitals actually do have a good specialization. The challenge with public hospital is overcrowding. So to find that specialty at a specific time is a challenge. I mean, the government does have some of the most qualified doctors because they employ them directly, a lot of professors. But the burden that's been put on the public sector is very, very big, which results to inefficiency, queues, and a lot of pressure. So what we are saying is that a lot more people should use affordable private healthcare facilities. That's why that's the area we want. Now, the government currently, the public sector currently accommodates 80% of the population, whilst the private sector 20%. So that's not equalized, and we think a lot more people should go to the private sector through facilities such as ours to release the pressure, and that will result in an improvement in the quality of service.
I really thank you for your time this morning. This RH Bophelo CEO, Quinton Zunga.